Welcome to the Adjustment Assessment Training Module for Moody Health Center at Texas Chiropractic College. I'm Dr. Corey Mayon, the Director of Clinical Education, and I'll be leading this module. Today's module will cover what an adjustment assessment is, the questions that you're grading, and I'll show you a live example of this assessment. Let's say you're ready to do an adjustment observation or assessment, which is an assessment of a chiropractic manipulative therapy or a joint mobilization. You'll walk into the room, access your assessment portal, fill out the assessment intro page, and then select the type of adjustment. If it's an extremity, make sure to type in the location, and if it's a mobilization, please type the level of mobilization. You're allowed to assess up to 3 adjustment assessments per encounter, meaning if a patient needs cervical, thoracic, and lumbar, CMT, or joint mobilization, you may assess all 3 in one encounter. There are 5 data collection points or questions, and we'll go over those soon. There is a notes section on the specific regions so that you can type during the encounter what went well or some things to improve on. The average is taken of the 5 scored components and then given to the student to see if they meet or exceed benchmark. Please remember to give verbal feedback and then document that verbal feedback on the feedback page. This is a copy of the handout that you were given. In the top section, you'll see the questions. Above each question is a title and a one-word summary of the question. To the right of the question, under the letters MC, are the listed metacompetencies that are associated with that question. If you need to know what the question is covering, you can use the metacompetency descriptions at the bottom of the page to show you exactly what each question is evaluating. This is an overview of each question. Question number 1 on a manipulation assessment is the pre-evaluation or necessity. Did the student establish necessity of a chiropractic manipulation or joint mobilization by doing an examination and finding a restriction? Number 2 is their skill and their setup. Did the student position the patient correctly, and did they preload the joint adequately and correctly? Question number 3 is skill and delivery. This is the actual components of the thrust and the physical precision, including speed, amplitude, direction, all the pieces that make a chiropractic manipulative therapy effective. Next question is the follow-up or effectiveness of the treatment. This is if the student asked the patient how they responded to the manipulation, as well as physically assessed their response to the manipulation. Lastly is their conduct and their professionalism. Did the student act appropriately? Once you've graded each component, then you'll submit and go to the feedback page. On the feedback page, select the assessment, then document a short description of the verbal feedback that you gave the student either in the room or directly after the encounter, of things to improve on as well as what went well. Next, you'll document if clinical education review is required. This is if a student scored well below benchmark and you feel they need directed individual training on that assessment. Once all that's completed, you'll type in your 4-letter verification code that only you and the clinic data manager know. Let's see what this looks like. Walk into the room, open your assessment portal. You'll select your name as the attending, and then check the intern or student that you're evaluating, in this case, example student. Choose the clinic level that they are in, and type the chart number. Next, you're going to pick the case type, which is alumni, case study, outpatient, outreach, staff, student, or other. In this case, we'll click other, and we'll put training. We're on the adjustment assessment, so we'll select adjustment and hit the next button. Region 1. Let's say I'm watching a student do a cervical manipulation. We'll click cervical. Question number 1, pre-evaluation or necessity. The student determined indications and contraindications for chiropractic manipulation through a regional exam. Let's say, yep, competent. Skill setup. Student adequately preloaded the joint and maintained safe doctor and patient positioning. Remember, this is the Dreyfus model that you've been trained on. Skill delivery. Student delivered effective HVLA or joint mobilization with correct speed, amplitude, and direction. Follow-up or effectiveness. The student identified and documented, keeping HIPAA in considerations, the effects following chiropractic manipulation. Lastly is conduct and professionalism. The student acted professionally through appropriate bedside manner, hygiene and conduct, and considered ethnic, cultural, and socioeconomic needs. Here, let's say that I saw the student do the adjustment and their right hand was faster than their left hand. Okay, manipulation region 2. Let's choose an extremity, and we have to specify the extremity, so we'll type in ankle. Again, you'll read each question and score appropriately. Okay? You're only required to do one manipulation region per assessment, but you can do up to 3. So we can skip this third assessment. Click Next. Now on the feedback page, we did an adjustment. And remember, we talked to the patient and the student, we talked to the student about their adjustment. So, what went well? Speed of right hand. Things to work on. Non-dominant hand speed. In this case, it wasn't a performance that required clinical education review, so we can skip that section, and then you type in your verification code. And that's it. That concludes your adjustment assessment training module. If you have any questions, please refer to your handouts, the syllabi, or the clinic handbook. If answers can't be found there, please refer to the following. For clinical operations questions, ask the Director of Clinical Services. For educational concerns, you can ask me, the Director of Clinical Education, and for resources, please ask the Clinic Data Manager. Thank you for your attention.